How to make Restylane absorb faster? I was slightly over-injected in one tear trough with Restylane. I will not get hyaluronidase because it's minor and will probably look much better once more Restylane is absorbed. Is there anything I can do to make the Restylane absorb quicker? Massage or moving the area more often, for example? Once the Restylane has reduced a bit more, I also think I need a slight addition of filler below the tear trough and above the cheek. What do you think?
Thank you for your question. You submitted a single photo and you state in your question that you got overfilled with Restylane on one tear trough area. You don't want to do hyaluronidase to dissolve it, but you want to see if you can massage it and can you get it to absorb more quickly. And in addition, you also state at the end of your question about maybe adding some Restylane in some other areas to further improve the cosmetic result. So I can certainly give you some guidance from my perspective. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people around the eyes with fillers such as Restylane is something I do every day in my practice. And I can share with you a little bit of some guiding philosophy I have when it comes to the tear trough area. Well, first of all, I would also ask, because in this question you didn't state how long since your injection was this photo taken. You see, when you do a correction of any area with injectables, there's a certain amount of reactive swelling, there's a certain amount of swelling from the injectable itself in terms of its absorption of water. And so the timing of the evaluation does make an impact. In my practice, I tell patients that to come back after 2 weeks for reevaluation, because during that time a lot of things kind of settle out and balance to a level where I think that they're going to be stable for a certain amount of time. Now, Restylane is one of the softest of the hyaluronic acid fillers. In terms of the spectrum of hyaluronic acid fillers, there is different levels of fillers that have different types of viscosity based on the cross-linking of hyaluronic acid, and with that also comes a certain longevity. However, as far as the absorption of Restylane tear trough area, there's a certain amount of unpredictability there. The way it's placed under the skin at a minimum, and in general, I would say it's placed deeper. In other words, placed under the muscle. Now, in that scenario, I have seen Restylane be present, or a hyaluronic acid filler in this area for that matter, be present for years. So, and I think that to a point, the body can sometimes form some type of capsule that can make the material actually last even longer. So, to answer the question about how to make it absorb faster, I don't think there's a good answer to that. There is a way to, of course, try to sculpt it, and that is with massage, but I wouldn't say that there is any value in necessarily being overly aggressive to try to get it to break up or to absorb faster. So, yeah, I think you have to do a little bit of observation. Now, to answer the question about areas of volume that may benefit, I think that you're certainly on the right track. I always tell people that when they look at themselves and they look at under eye hollows, very often they overlook the fact that they're actually also hollow in their cheeks. And so when I look at people, I don't just think of the tear trough or the eyelid, I think of the eyelid and cheek as one aesthetic unit. So it is not unusual for me to not only fill the tear trough, and just think about it, and it may be something in your situation. When you do just a tear trough area with someone with a relatively shallow cheekbone, it's almost like you're creating a ledge or a shelf, and that ledge is just kind of hanging by itself. So I think you're recognizing that a little bit of volume in the cheek area will also be a value. There's an area right at the eyelid-to-cheek junction that typically needs volume called the V-deformity, and it is routine for me to add volume in that area. A lot of my patients, particularly those women who are over 40, 45 years old, who are very fit and have relatively thin faces, they benefit from actually cheek lifting using a filler such as Juvederm, but placed at a deeper level and a structural level so that the eye is framed by the cheeks. I think of injectables in so many ways like the art of surgery, and that there is really a lot of ways to look at a certain area. A lot of people tend to be more regimented in the way they do things. If you come with a tear trough complaint, they'll fill the tear trough. If you come with a nasolabial fold complaint, they'll fill the nasolabial fold. From my perspective, these are all more parts of a larger issue where volume loss, bone, muscle, fat, actually can be more artfully managed by more definitive, more global procedures. So we do a procedure where we're doing structural volumizing, where a person who may come for just a nasolabial fold, when they see the restoration of the cheekbone and the jaw angle, they don't even think about the nasolabial fold because the nasolabial fold is actually not the issue in and of itself. It's the volume surrounding it. So I think you're on the right track in that it's not just the tear trough, it's also the cheek with the tear trough and under eye area. So again, I think that you should communicate with your doctor, look at what your options are in terms of the realistic potential for improvement. I think a lot of times you just have to wait it out and let it absorb and let it kind of blend over time. But if necessary, hyaluronidase can be of value in your situation as well. So I hope that was helpful. I wish you the best of luck. And thank you for your question.